A Scottish charity is currently working in Nepal to try to improve access to healthcare in some of the poorest parts of the country. EMMS International has funded their first ever specialist palliative care nurse. As well as providing help for those reaching the end of their lives, they're also training other medical professionals. In the first in a series of special reports, our reporter Susan Ripple has been to meet her in the shadow of the Himalayas.
These small steps mean the world to Pabitra. For the past 5 years, she had been bedbound after sustaining a spinal injury following a fall. But thanks to the help of this nurse, she can now make the short walk from her home to the hospital for a physiotherapy appointment.
I was afraid of what would happen to me, and I was afraid of how my family would feel. Now I feel much better, and it's good to be able to walk to the hospital and leave my home. My daughter is very happy. She says, "Mummy is getting better. She's well now." If my daughter's happy, I'm happy.
Manju has been working at the Mission Hospital in Tanzania for the past 3 months. She's the country's first specialist palliative care nurse, a position funded by the Edinburgh charity EMMS International. Nepal is vastly under-resourced when it comes to providing help with serious illnesses and conditions. There are just 10 centres providing palliative care, only one in rural Nepal. A staggering figure, as more than 80% of the country's population lives in these remote areas. Here, Manju is explaining to this man that his mother is too frail for aggressive surgery, advising him the best course of action would be to end the life support. 2 hours after filming, she died.
When we know that patient is not going to improve, it is really hard to tell them what will be the outcome. But the simple thing, when I see even they are in the suffering stage, they are in that critical stage. If you can bring the smile on their face, I think that is the big thing. They trust me. They trust palliative care.
Manju has not only helped Pabitra physically, but also mentally. Pabitra's husband left her after the accident. Her mother could only watch as her daughter fell deeper into depression. She still feels guilty the family were unable to afford the healthcare Pabitra needed.
She was in bed for a long time and I couldn't offer her treatment, so I felt sad. Now I'm very happy, and now that she's able to walk around, I feel positive.
Manju has now finished her placement here and is moving on to Kathmandu. As the interview came to an end, Pabitra said her goodbyes. An emotional time, showing her gratitude to a woman who listened and cared. Susan Ripple, STV News, Tanzania in Nepal.
A Scottish charity working to improve access to healthcare in Nepal is hoping to build the country's first palliative care training centre. At the moment, there are limited resources, with few healthcare professionals being trained in how best to care for the terminally ill. Our reporter Susan Ripple has been to the site, where the charity hopes to build the pioneering facility.
33-year-old Juna, in a rented one-room house she can't afford to pay for. She's widowed and her children are living in an orphanage. For most, these personal circumstances would be hard enough. But Juna also has incurable skin cancer.
It was very difficult for me before. I was having my own health problems and having to look after both the children, and I was worried my husband was not there to take care of them. But now my health is getting better and they're getting proper education, so I'm relieved. The doctors and nurses frequently gave me counselling and it was comforting. They've been a lot of help to me. If they were not there, then maybe I would not survive.
This support has been coming from the local hospital Green Pastures. Staff here have been working to improve palliative care, which at the moment is limited to just 2 beds. It was initially set up as a leprosy colony, providing care for those who had no home to go to. Now they're seeking to expand their services, thanks to the help of a Scottish charity. This is the site here where EMMS International is hoping to build this new palliative care unit. It will include 10 beds as well as a pioneering training centre for medical staff, turning what is essentially at the moment rubble into a life-changing centre.
We believe that this will make a big impact. It's not an overnight thing, but as we start the pioneering work in palliative care, people will be able to get the treatment from here, and we're also able to train the health personnel. They can go on to the remote areas where we are not able to go.
Development of the centre is still at an early stage, but if it goes ahead, the charity hopes it'll be a catalyst for change not just here in Pokhara, but also across the country, giving those struggling the most the chance for a more comfortable life. Susan Ripple, STV News, Nepal.
This week we've been following the work of a Scottish charity in Nepal as it tries to improve access to palliative care, a task which has become all the more necessary following last year's earthquake. Now EMMS International is conducting a survey to assess how many people in some of the worst affected areas have palliative care needs. Our reporter Susan Ripple travelled to the epicentre of the quake.
Shir Kumari was forced to leave her home following last year's devastating earthquake. The 65-year-old is still waiting for funding to rebuild. She finds it hard to talk about what happened that day.
I was in another house when it hit, and I remembered my family were still at my home. I was worried they were trapped, so I ran as fast as I could to rescue them, but the land was shaking so much I fell. I got back up and I could see my family were outside, safe, but I watched as my house fell down. My heart was sad that my house was gone, but I was thankful my family survived.
Koplang Secondary School here was completely destroyed during the earthquake. Thankfully, it hit on a Saturday, so there were no pupils inside. The building has been so badly damaged, it's now being demolished. It took up to 9 days for relief workers to reach some of the most remote areas. The difficult terrain evident on our drive to what was the epicentre of the quake. Scottish charity EMMS International is trying to assess just how many people still living here have palliative care needs as it works to improve access across the country.
People often spend their entire savings on medical care that's not required or needed to demonstrate their care for their loved ones, and that leaves them destitute at the end of the process. So for us, palliative care isn't just about providing care for those in their final stages, but actually enabling families to care properly for their loved ones, actually without leaving them destitute.
As we've seen this week, the charity has already funded the first specialist palliative care nurse and is working to build a pioneering training centre. But given that this kind of care is still at such an early stage here, it says more needs to be done at a national level.
If somebody suffers, he or she should get access to the pain medicine, psychological support, physical support, social support. This is very basic. This is a human right and a basic need. They need it. And we have to, this is our duty, we have to provide it.
The country has been through so much in recent years, and as it slowly rebuilds, this Scottish charity hopes increased awareness of these basic health rights will mean more people can live comfortably and with dignity. Susan Ripple, STV News, Nepal.